So with that, we are going to jump into our next session, and this one is our plenary. For those of us that are joining us online, this will be the last session of the day in terms of the virtual participation. We have breakout sessions, but those sessions weren't set up, for the virtual. So we appreciate your spending the time with us and joining the group that we have here in the room. And for this final session, at least for the virtual, before we go into the afternoon breakouts, is a conversation really in terms of institutional review boards for tribal nations and communities. And, in the process of really thinking about how to put this topic together, it really gets to the heart of how the idea of this doing research in indigenous communities came about. In 2015, the Arizona Board of Regents approved a tribal consultation policy. It's ABOR 1-118, and under ABOR 1-118 there's 4 components to it. One that was vetted, by the tribes through Intertribal Council and a Tribal Leadership Work Group. Navajo Nation is not a member of ITCA, so we shared that with the Navajo Nation for their review as well. And those 4 elements, the first one speaks to the idea that there are existing safeguards put in place when it comes to research in higher education and other research as well, protections that are there, but those are not sufficient for tribal nations and communities, sovereign nation, and issues of cultural patrimony and languages and other things that we talked about this morning. Those aren't necessarily included in the training when you're taking training to do research in tribal communities and in a way that protects those communities. The second part is really examples. When we say research, what does that consist of? And again, examples obviously is a better way of trying to identify that versus a laundry list of all the possibilities that could be, but can include blood and tissue samples, data on healthcare or education, a lot of work that's obviously, was responsible for the creation of NAGPRA, the idea of ancestors and cultural patrimony, environment, natural resources. Those all would fall under the need to consult anytime you're within the boundaries of federally recognized tribal land in the case of the agreement as it's spelled out for ABOR 1-118. The third piece was actually the protection, the continuation of these positions that have become somewhat of a phenomena across the country, and having special advisors or vice presidents at the president's office level, jobs much like mine, were really at the whim of a university if they created one. But at least in the case of the 3 state universities, it's codified in this policy that position should exist. So if for some reason, I'm not here tomorrow, the policy does require that the presidents of the 3 state universities have somebody in place to fill that role. And then the last one is, what we refer to as kind of DEFCON 1, DEFCON 2, and beyond, this idea that when you have something pops up that doesn't work, who's responsible? And the first step is, as the special advisor, it's my job to get in the middle and figure out what's gone wrong and how do we fix it. If I can't, then it goes to the president of my institution or president of NAU and U of A. And if it doesn't get resolved there, then it goes to the president of the Board of Regents to try and resolve it. If it's not resolved there, then it goes to the full Board of Regents. So it comes in with a lot of authority, and also recognizes tribal sovereignty and tribal consultation. Included in that language is, consult early and consult often in terms of working with our tribal nations and communities. So I just wanted to set the framework that this event in and of itself is a continuation of not only what we put on paper, but what do we do in practice, and how do we have these conversations, and how do we inform, and how do we share best practices in terms of how we do research. So I have really a stellar panel, with us today as we kind of delve into some of these questions. And I know that we're kind of doing some of this on the fly. And I want to go ahead and just do a quick introduction to those that I have a bio for. And I have a good friend who's agreed to jump in, and I'm not going to have her full bio, so I'll let Myra introduce herself, but virtually. We have Del Yazzie, and Del is the director of senior epidemiologist for the Navajo Epidemiology Center. He received his MPH degree from Johns Hopkins, the Bloomberg School of Public Health, and I'll let him do his clan. Probably I wouldn't do a good job at it, and but he is his work is focused on public health, disease surveillance, data science, tribal health policy development, tribal health research and training, and again, he's a member of the Navajo Nation Human Research Review Board. We had the opportunity to work with Del at the heat of the pandemic. Otakuye Conroy Ben, who I think I saw in the room earlier, I'm not sure if she's still here, who does wastewater epidemiology. And so we were actively involved in working a number of the chapters in providing data and information during the peak of the pandemic to the Navajo Nation Epidemiology Center on surveillance that was being done through wastewater epidemiology. We also have Amanda Hunter, who's a citizen of the Pasquayaki tribe, born and raised in Tucson, and her interest is in public health research, ignited after working in the medical field and recognizing the great need for prevention of chronic diseases that often brought patients into the office and pharmacy. And so she received her MPH and PhD in health behavior and health promotion, and at the University of Arizona. She's completed her postdoc at NAU in the Center for Health Equity Research, and we're very happy to have her as a new early career faculty member here at Arizona State. And then again, I'll maybe throw the first question to Myra so we can get rolling here. But in the process of the question, I'll also give her the opportunity to introduce herself as well. So again, conceptually what we're looking at is what are the unique challenges faced from tribal communities in terms of research, and how do these challenges differ from what we typically understand in terms of mainstream research. So right off the bat, Myra, the question would be, and then again, we'll just kind of do round robin and pivot and just, whatever works for our panelists and where this conversation goes. So the first question is, what are some of the key barriers that prevent Indigenous communities from establishing or maintaining tribal IRBs, which again is important because as we think about how we build a bridge out to tribal communities when it comes to IRBs, how can we support tribes build the bridge on their side to connect with our institutions? So, thank you.
Thanks, Jacob. Hello, my name is Myra Parker. I'm Mandan and Tidatsa. I'm an enrolled member of the 3 affiliated tribes from Fort Berthold in North Dakota. I was just there last week for Thanksgiving, and it's a little bit colder there. Already had some snow and black ice on the roads, so it's wonderful to be here today, here in sunny Tempe, and be able to enjoy the fair weather and friends here in the audience. I used to work at the Intertribal Council of Arizona after I graduated with my law degree and my MPH from University of Arizona. And that's where I was trained, basically, by John Lewis and the late Alberta Tippeconic, who were my bosses there. And they actually received a Native American Research Centers for Health grant in collaboration with Dr. Yvette Rubidoux, who was at U of A at the time, and also Dr. Jenny Joe, who was also at U of A at the time. And so learned firsthand about some of the challenges in navigating research review processes, both on the university side as well as the tribal side. And so I'm sure that many folks in the room know that the IRB is just one layer of the approval processes that need to be adhered to when you're wanting to do human subjects research. Another layer, as I learned from John and Alberta, was the tribal approval process, and that obviously varies by tribe depending on what the tribal government has laid out for the research review process within their respective administration. So As we heard earlier today, some of that is codified, some of it is through the tribal council, and it just varies by jurisdiction, just like any other jurisdiction. There's a different process in order to obtain the research approval from the tribal government level. So with tribal research review boards, that may also be another layer to the process, because the tribe, like Navajo Nation, for example, the Anautham Nation, may have codified, exactly how the tribal research review process also works. And I could talk about this all day. I love this. I know this, everybody's kind of like, oh my God, are you kidding me? The IRB process is like the worst. But it's so important because I think, as an earlier panelist mentioned, this is how we know how to do the research in the right way that's approved within that tribal community. Everything in that review process is spelled out, and your whole team has to be basically trained on your protocol in order to ensure that you're adhering to the approved processes that have been designated by both maybe the tribal research review board, your institutional IRB, and also the tribal government's approval process, whatever that might be. So just as an example, one of the challenges with tribal research review is that it's almost always not funded. And that makes it really challenging for research review to occur at the tribal level, because basically you're really asking people to come together on a volunteer basis. You might have some funding perhaps through the tribe, but oftentimes in some communities that's just not feasible. It's not available. And so I've had colleagues who have said, yeah, I'm totally committed to making our tribal IRB work, and I'm totally happy to drive 400 plus miles every month to sit down in person and review applications, like hundreds of applications that come through our tribal IRB, because of the importance, of having that opportunity to ensure that it's adhering to some of the issues that Jacob mentioned earlier, like the cultural preservation issues, the issues around our ancestors and how those that information and data is handled, because a lot of tribes don't see those as falling outside of the research review process. In contrast, at the federal level, when you look at the IRB regulations, it only applies to people who are alive. And so, there's a dichotomy there that the tribal research review process then has to kind of bridge and understand, like, okay, how do we, for our community, protect the data and information that's associated with our lost loved ones from previous generations. So that's just one example of the work that tribal IRBs or RRBs do. And it's so pivotal because we know that we need to protect that information for the benefit of not just today's community, but also for future generations ongoing into the future. So I recently read, I'll just share this and then I'll hand it over back to Jacob. I recently read a novel. It's obviously fiction. I'm into sci-fi, just like somebody else mentioned. I love Star Trek. It was about terraformers. And so these terraformers were like off on some remote planet, like making it into a suitable, hospitable Earth equivalent. And they did so by basically stealing indigenous DNA. And so they created a whole host of multiple generations of slaves, essentially, to terraform this planet using indigenous DNA. And the reason they did that was because they wanted to make sure that it was like an Earth-like environment. But to me, like, this was, for people who are non-indigenous, reading this book, it might have been like, oh wow, that's kind of messed up. But for me, it was terrifying, quite frankly, to think about, because I don't do DNA research, I do socio-behavioral research, but just to think about the notion of our native DNA, eons into the future being used to, again, subjugate us in that kind of a way, just made me realize once again the importance of ensuring that we're establishing the research review processes that are important to our communities and that really have to be upheld and clarified for those who are unfamiliar with them.
Okay, thank you very much. And before I go to Amanda, I'm going to go ahead and jump over to Dal, one in parts to, give you an opportunity to complete the introduction. And then also, I think because of your role serving on the Navajo Nation IRB committee, I think the question is also relevant to what you do. The fact that the Navajo Nation does have an IRB, but the same question around key barriers, that even in the work that Navajo Nation does, that makes it hard to even maintain a working IRB. As Myra suggested, is that sometimes people cringe when they think about having to go through a tribal IRB process. But maybe I'll throw that question to you, and then again allow you to also introduce yourself. So, thank you.
Yeah, thank you. Thank you. I hope you can hear me. I can hear myself.
Yes,
There's
we can hear you. We got
okay.
you
All right.
perfectly. Yeah.
Hi everyone. My name is Del. A Navajo tribal member. My clans are Kintachitni, is my mom clan, and then my dad clan is Tachitni, and my maternal grandfather clan is Ashkatzoy, and my paternal grandfather clan is Maidishkijni. So that's who I am. I am with our Navajo Epidemiology Center team and with the Navajo Department of Health and the Navajo Tribal Nation. And yeah, I think Myra spoke to a lot of areas as far as this first question. I think being with an actual, IRB, a tribal IRB, and being a board member and going through some of the activities with regard to our tribal IRB and research on the Navajo Nation for some time now. And I think funding is spot on to support tribal IRB activities and also to support the um, the board members, the help and the in providing guidance and support for research, the proposal reviews and the approval and disapproval processes, et cetera, et cetera. So, and also I think the bigger issue is, in my opinion, is I think what's the purpose? I think tribal nations, I think a lot of times we don't have the capacity to, really implement such a program for tribes. It is a large undertaking to really run or operate a tribal IRB. Is it what's the tribe's take on what is what does research mean? The term research to our people, our tribal, indigenous people, what that means. I think oftentimes there's a lot of suspicion on what that means, based off of just historical research activities that were, performed on tribal nations, tribal peoples throughout the history of the U.S. And then also some ongoing current, concerns and issues that we hear about where, DNA research or genetic research, oftentimes people are very suspicious about that. And I think rightfully so. Some researchers have done unethical research work. I think everyone has probably learned about what happened with the Havasupai tribe, with some diabetes related research there. and then did some additional genetic related research, unapproved by Havasupai tribe. So those are some areas that I think a lot of people tribal people have concerns over. And again, rightfully so. And also I think actual board members, how are they appointed? As far as, at least for Navajo Nation, there are people, those of my colleagues on the board were appointed by different entities to serve on the board. I'm appointed by the Navajo Nation Office of the President and Vice President. So there's 3 of us that we are appointed through that, our president's office. There are other members appointed by Navajo area IHS. And then there are others who are appointed by our tribal council. So there are a number of us on the board that are appointed by different entities, serving a 3-year term. And at the end of each term, there's a renewal process. You either get reappointed or you step down or you don't get reappointed. So that's the kind of the protocol. And then the administrative processes, the actual meetings, the quorum, the recording of meetings, and then the approvals of progress reports by PIs, quarterly reports, annual reports, final reports, close out, how are you going to disseminate the information? And then what's more important also is, I think, the engagement of communities here on Navajo, at least for us, one of the required documents that needs to be attached to each application is the community where the research is going to be conducted, their approval that shows that the researcher, the PI, is engaging the community and that they went to an actual chapter meeting, for example, and presented the project, and that the community members were there and they approved their project. And then on top of that, as Maya alluded to, there are different layers, even with our own tribal IRB. Another layer of approval process that we require is the agency level of Navajo Nation. There are 5 agencies on Navajo Nation. If your project is in one of those, you need to go to an agency council meeting and get their support or approval as well. And also approval from IHS, for example, Navajo area IHS, their CEO, their support and approval for the research. So all these need to be in place. And I think these are, I don't really, they could be barriers. Like I said, it's a large undertaking. And all of these need to be identified and put in place really before, I think, the launching of an IRB program for a tribe. And then there are, of course, other areas as well. And like IRB is approved, it's through the tribal council. It's an actual legislation approved by our tribal council. There's a research code within this legislation on how the IRB should function and operate. So I think oftentimes that could be, the tribe might not have all of that in place to begin with. And so that could, potentially could be a barrier. So I'll stop here. So thank you.
There we go. Helps if I turn it on. Um, all right, so Amanda, we heard a little bit in terms of a tribal perspective about the importance, but how would you go through the process of one establishing an IRB in a tribal perspective? The question I guess I want to pose to you is from the other side, as a researcher, and also one interested in terms of working with your own community and also really helping support tribes and understanding, the research side and how you create these apparatus to do this in a good way. how can researchers balance academic goals and institutional expectations? You have your own expectations in terms of your own research and your career path within higher ed. So how do you do that with respect to Indigenous community priorities and sovereignty?
Leo Senchi Manyavu, Ketchamalea, Inepo Amanda Urbina Hunter Thea. Hi, my name's Amanda. I'm a member of the Pasquayaki tribe from Tucson, as Jacob mentioned earlier. And I just started here at ASU in January as an assistant professor. And so this question about balance is honestly something I'm just learning. I have been lucky to have really strong mentorship from people who have been working in Indigenous communities in Arizona for decades. And so I've kind of been learning techniques on how to balance as an Indigenous researcher who from Arizona, who's also in an academic space. But I think one of the things that I have been learning is patience, first of all, as a researcher and also as a community member. As a researcher, and I feel like an academic, you kind of have to be a little bit type A sometimes, where you have your deadlines and your timelines, and even as a student, you kind of have to have all of those things, and so you can kind of get stuck in this mindset of, oh, this is my deadline, but recognizing that when you're doing like a community engaged research, that you need to be involved with the community first, and so some of those deadlines are just basically kind of in your head, and you're making a little bit too much of a big deal about it. And so I've kind of have learned to make sure I include time to work with communities within these kind of timelines that I have in the academic space. I think I, have also really been trying to be mindful from the start, from when I started working with communities as a master's level student, and being transparent about what my needs are from the academic institution. So, as a master's student, I had to say that I need to write an internship report on this work that I've been doing. As a doctoral student, I have to write a dissertation, and I hope to get it published. So being transparent with the communities that I was working with, that I, will hopefully be able to publish this information in the future with your support and your approval. And so I continue that to this day, is just working with my community advisory boards and different tribal councils that I've been working with about, I am employed by this institution, and these are kind of some of the things that I need to do as a part of this research. And so kind of just being transparent about that aspect, I think, is really important. I still just am learning, but really am trying to stay strong in my commitment to honoring the community priorities, community research, and public health priorities. Public health is my background, and so just recognizing that my research project might not be the priority of the community at this time, and if that's the case, I can still offer up the techniques that I've learned in research and evaluation, and if that is of use to the community that I'm working with, then maybe I can kind of switch my my task at hand, and seeing how I can be helpful for the community. And that, I think, also comes along with communicating that with the academic space, and my the yearly approval kind of process that you have to go through, and coming up for promotion and tenure and a couple years down the road for me. But just really finding ways to communicate that, although I may not have a million publications that you might need to be promoted, I'm still providing a really important aspect of community and relationship building, as being a good Indigenous researcher and honoring communities' priorities first. And I think I've just kind of also internally just keeping that mentality is that I am, being a good relative and a good Indigenous researcher and honoring my relationships there. And if down the line the university isn't happy with that, then maybe that's not the space for me. So if that's what balance looks like at the time, then that's what it might look like. Yeah, so I'm not sure if I, gave a good enough answer there, but
Yeah, it's good. It's we're all learning
yeah, still learning.
every day. So I'm going to shift back to Myra. And again, as she mentioned, she was here 24 years ago, I think. We were a lot younger. Well, I was, she was. Yeah, she's 35. Yeah, we were 10. With her time with Intertribal Council, and then also she actually worked in the governor's office as a liaison for Napolitano when she was governor. So we did work together when I did the government affairs at Salt River, but also just kind of following her career path in terms of a MPH from University of Arizona, a law degree. Is that from U of A also? And then when they went, her and her husband David Lishart, when they went to the Northwest, got her PhD at University of Washington, and has been up there ever since. And then I still very much follow, the work of really these warriors, in our higher education, and Myra being one of them. So Myra, if you maybe can explain a little bit in terms of your program, that you do at University of Washington, because I know that you're working with tribes throughout the Northwest, and also I think work along the Pacific Rim as well. So maybe just a little bit of context in terms of the work that you do, but also the question that would be tied to that is how can universities and tribal IRBs work together to improve the review process for research that involves Indigenous communities? Because I know you're very much deep in that work in what you do as well.
Thanks, Jacob. Yeah, so I got my PhD in health services, which is one of the branches of public health up at University of Washington that they provide training in. And right after I graduated, I was able to be a fellow in a T32 grant that my mentor, Mary Larimer, still leads to this day. And it was on alcohol research. And so I had the opportunity to work with Dr. Bonnie Duran, who recently retired, but at the time was leading these tribal epidemiology studies and an alcohol intervention study with tribal college students and universities across the U.S. And so as a fellow, I was able to kind of step in, and of course my role was to fill out the IRBs. And I really enjoyed that work though, because I was able to kind of see across all these different tribal IRBs and RRBs what all of the protocols were and what some of the cultural pieces were that were attached to the review process that you needed to address and understand. And I think that work really informed the work that we do today at Seven Directions, which is a public health institute that I started along with several team members at University of Washington to be able to provide technical assistance and training to tribes and urban Indian programs. It was actually a colleague of mine, Alina Kawe, who is also Pasquayaki, and now she lives in New Zealand, so she's kind of living her best life. But she laid the groundwork with Intertribal Council of Arizona's support and other folks across the different tribal communities here to think about, what is a tribal public health institute? Do we need one? What is the purpose of that? And then after she moved on, she kind of left that to me and the team at UW to go ahead and begin that work. And so we started this Tribal Public Health Institute. We're members of the National Network of Public Health Institutes. There's usually a public health institute or 2 or 3 in each state. And I think there's a couple here in Arizona. And a lot of it is, managing large data sets, doing training, doing technical assistance, research, evaluation. There's a lot of different pieces that these institutes can play. And for us, one of the things that we focus on is ensuring that Indigenous values are imbued in the public health work that we provide and do with and for Native communities across the U.S. So one of the projects that we're also funded to do, in addition to some CDC-funded work that focuses on technical assistance, is we actually are one of the technical assistance providers for the NCREW program, which I am so horrible with acronyms, so I think it's the Native Collective Research to Enhance Wellness program. And this is funded through the National Institute on Drug Abuse. And so we actually tomorrow are offering a webinar for folks in that program to talk about this new funding opportunity. And again, like I said, I'm sorry, I'm referring to my phone here, but there's actually an NIH grant that's available to help start tribal IRBs called the TURBI R24 mechanism, the Tribal Institutional Review Board Establishment and Enhancement Grant. And that is due, I believe, in January. So if there are folks who are interested in applying to start a tribal IRB or to enhance the work that an existing tribal IRB is doing, there is actually a funding mechanism now that's available. And as one of the TA providers for NCREW, we're trying to help connect folks to these training opportunities to understand what are these mechanisms, what are some of the opportunities out there that can help supplement and expand and deepen the review processes that are provided through tribes. I guess one other thing that I would say, and this isn't necessarily linked to the current work that I do at Seven Directions, but what I learned as a staff member, both for ITCA and also with the work with Governor Napolitano, is really the need to respect and uphold tribal sovereignty in all administrative processes. And I guess I see at IRB the research review process as one of those administrative processes that we as academic researchers need to respect. And by doing that, we're upholding tribal sovereignty because the tribes are establishing what that research review process looks like. And so we need to understand that, and we need to learn about it and take the time and effort to work through it in a diligent and meaningful way in order to ensure that we're doing our part to uphold tribal sovereignty. I think, I've been actually on calls with different tribal RRBs and IRBs, and there have been actually researchers on these calls because a lot of them during COVID are offered, remotely through like Zoom or a similar webinar service, who are not very respectful, quite frankly, to the folks who are on these review panels for tribal IRBs and RRBs. And they kind of push back on some of the policies, the IRB review policies that the tribes have established. And they kind of pressure people to make a decision about their research project right then and there on the call. And I would say that, there's kind of the paperwork process, but there's also the relationship development process that also is essential when you're working with a tribe, whether it's your own tribe or a different tribe, and being respectful to the folks who are taking the time and energy out of their day, time away from loved ones to go review your research project is probably, at the top of the list in terms of ensuring that you're developing a meaningful working relationship. And I hope that, folks who are thinking about applying for research review with tribal communities are really hearing that and understanding that in the best way possible, because I think that's where then, if you're not doing that, you get down towards these other instances of abuses, like what happened at Havasupai and other places, where tribal information and data was not thought of in a respectful way and was not seen to be needing the protections that are afforded to every other community across the U.S. Under the federal regulations.
Okay, the last question, and I'll pose this to each of our panelists so that we can, we have about 15 minutes and hopefully a little bit of time for a Q&A. And let's see, so Del, I know that one of the things that kind of stood out for me in terms of going through this process of seeking support from tribal governments on putting together a consultation process was this recognition that, as you discussed earlier, this historic um, kind of negative perspective around research, as related to archaeologists, anthropologists, and research that was done without consent, um, as kind of the where we typically think about research. And in the process of, going before the Intertribal Council for a resolution that we can then take to the Board of Regents to say that they're in support of this consultation policy, is that we were the fourth to present, and the three that went before me, before the tribal leaders, was the Indian Health Service, and then the EPA, and then the Arizona Department of Revenue. And those were not good conversations. I know that the tribal leaders were very upset with Indian Health Service in terms of providing quality service within their community around behavioral health and other issues. And so, it was not a good conversation, and then they sent her on her way. And then the second person from EPA was there to explain the Gold King mine spill that really was detrimental to mainly the Navajo Nation and its waterways as a result of a spill up in Colorado, and were there basically to, kind of fill in the tribes on what happened. And again, that didn't go well. The tribes were really, kind of came to the defense of Navajo Nation, and also the idea of diligence in protecting our communities and the role of EPA. And then the third was the Bureau of Revenue, or State Department of Revenue, that was asking for tax information on tobacco tax that they really had no authority to ask for. And tribes are very clear, it's under tribal sovereignty. We don't have to share that information with you. But more importantly is, why did they need it? And this poor young man that went into that meeting from the department, admitted, well, it's really the manufacturers that were looking for parity in terms of your tax structure with what's being sold off the reservation. And so he got, slapped around a little bit and then sent on their way. And so I was thinking, we're next, and I represent a university, and we want to talk about IRB. So, but what I shared with our tribal leaders is that, there's been a shift in terms of really the importance of data, that if you look at the three that came before us, that's all data driven. And this is information that you need as a tribal leader to make those kinds of decisions. And you're sending your students to our institutions to, learn that, learn how they can bring this back to your community and help support you, whether it's environmental or healthcare or economic development. And so my plea to them is that, or recognition, is that it takes them a long time to get through your IRB process, and sometimes they have to extend their scholarship or extend their time in higher ed, or they have to change their dissertation. And so how do we build this bridge so that we can both, really work in a way that would not only support your students that are attending our institutions and faculty, but also help benefit the community in that much needed research and data that supports the community. So a long way to get to the question, Del, but I think what I really appreciate that the Navajo office does is you'd have a biannual workshop where you invite those that are doing research to come present. And my understanding is that model is to ensure that those that are doing research is sharing that back with the community, so that they can not only know what's going on, but really maybe learn from what that research has been doing, so that it's not just extractive, that this can go back and to help support the Navajo Nation. And I know you get a whole variety of different types of research, but you try and narrow it down, to some particular topic areas. And so kind of shifting out of that idea of regulatory, how do you see, the work that you do with the Navajo IRB really help support and strengthen the tribe from the research that's being done there by others outside of your community, and sometimes your own students or own researchers?
Yes, thank you, Jacob, for that question. I think, again, there are a few layers to my response. Is I think in collaboration with the universities and the researchers coming from these academic institutions, we are, just historically, the Navajo Nation's IRB really has evolved over time, starting back in the mid-90s, where the tribe really took control of our research program coming from IHS, Navajo Area IHS's program, and transitioning over to Navajo Nation's authority to uphold or implement this research program. So it's been, I don't know, what is that? Almost a 30-year time period. And the evolution of it, there's a lot of my predecessors as board members have done an amazing job to get this in place and to get it going and to get it to where it's in full operation, and the council getting the research code in place and functioning through that mechanism. And so are my former, I don't know if some of you might have heard that our actual, the founder or the lead person that really put our research program in place, Miss Beverly Vicente Pigman, under her guidance and leadership has, over the years have really put our research program to where it's at currently. But, unfortunately, she passed on a couple of years ago. So, and then some of the members with Miss Pigman have recently decided not to, renew their membership. So they essentially stepped down. We just honored them last week at a council meeting, and gave them, some Pendleton blankets and recognized them and honored them for all their service to our research program over the years. And so what I'm trying to say is there's some new members who are now a part of the board, and we're really working on somewhat modernizing our research program, which will only, I think, a part of it will enhance our partnership with academic institutions, including those the PIs. And I'll say that a lot of what we're beginning to see is which is great, is that we're beginning to see a lot of our own Navajo student research dissertation proposals coming through our board, and which is great to see. That's, part of our own capacity building for our nation, for our own people, our own Navajo people well, not just Navajo, but other American and Alaska Native folks as well, doing research. And, Myra just talked to seven directions, we plan for 7 generations ahead, So that's a part of the idea, the concept of growing our own, and that we are in partnership with academic institutions like U of A, ASU, UNM, some regional, local academic institutions here in the Southwest. And also some are like farther away, like Johns Hopkins is a longtime research partner here on Navajo. And we're really, working with our researchers and academic institutions to make sure we're approving their proposals in a timely manner as board members. And we are fully, we understand and fully consider the timelines that some of these researchers have. And also, reviewing of manuscripts that are being crafted by researchers, and it comes through our board members to review and approve before sending it on to a journal that's going to be published in. So that's one of the ways we're also engaging with our PIs. And then we're making sure as board members, we're reviewing these manuscripts, proposals, annual reports, ongoing progress reports in a timely manner with our new board members. So, and we also transitioned to Zoom meetings. We have our monthly IRB meetings that occurs on the third Tuesday of every month, and it usually goes all day. And our PIs join us. I think they all appreciate that it's virtual now. Before, Ms. Pigman really was adamant about PIs coming to these meetings in person. I mean, some of these researchers are coming from faraway places, and they had to come in person. And that was Ms. Pigman's way of, to gauge their, dedication, their, sincere um, uh, help, I guess, in doing this work, public health work on Navajo. But now we've transitioned to Zoom, so we all have these virtual Zoom meetings ongoing currently. So that's one way of making things easier. We're also about to transition to submission of these proposals electronically. Before, well, it's actually still in place currently, but we're gonna soon transition to virtual submission of proposals instead of paper. So some of these proposals, as you all know, are 200 plus pages, and we require 10 copies. So that's like a lot of killing of trees, as you can imagine. So we're trying to modernize our IRB processes from our end to make things a little easier, and we're better engaged with our academic partners and researchers going forward. So yeah, and last, Jacob, I'll just mention, it's very important too. I'm with an tribal epidemiology center, and data is very important to us. And using data to make informed decisions is a big part of our vision here on Navajo and within our Department of Health, addressing some of our top priority health concerns, unintentional injuries, of course, diabetes, cancer, cardiovascular diseases, infectious diseases, COVID, as you mentioned, Jacob. We partnered on wastewater epidemiology project during COVID, which I'd like to continue at some point, Jacob, with I forget her name, but yeah, so those are some data is very important to us, and really trying to get at being able to house data that are coming out of these research projects. And then how do we use the data to address some of our health issues or health concerns here on Navajo? And so we're also working on that as board members, working with our research program and our tribal epicenter here in building that up. And hopefully at some point we'll get to a place where we're able to use some of the information, the data, the information that's coming from these research projects towards, our public health work here on Navajo. So maybe that's also a barrier for tribes, having that capacity to house information in a secured environment that's password protected, firewall protected, that because a lot of it could hold some personal health information. Not really research, but some of the data that's shared with us from state health departments. So these are, also areas that tribes, I think, have to consider in figuring out a way to house information locally. So that'll be my response, Jacob. Thank you.
Okay, thank you. Yeah, we're at time, but I'm going to do a lightning round for the two that we've got on the stage. So maybe I'll just give you 30 seconds and we'll give it time for at least one or two questions. So go ahead, Amanda. You look like you've got something that
Oh yeah,
has to be said.
I just wanted to say in response, to kind of Dell talking about the Navajo Nation's IRB process, which is laid out pretty nicely, as you mentioned. There's been like years and years of the process. And so you can kind of come in as like a, a student or a researcher who maybe not from the community, and the process is pretty straightforward for the most part. You can call up the office and talk to Mr. Winnie, and he'll tell you what to do. But it's not like that in every community, and so it can be kind of difficult sometimes as a researcher, whether you're a student or faculty member, staff, to figure out what the process is in different communities. And some communities may not have a set process. Some communities may have it in their constitutional code, their research code, but there isn't like a standing board or committee, and so it's kind of on you to figure out who to talk to, which department to partner with, who's going to be like your champion with tribal council, that kind of information. And so I just really appreciate Navajo Nation being like having a set process. But I do feel like that is one way that as a university, I don't want to add any work to anybody's plate, Jacob, but having somebody from the university kind of sit down and figure out like this is the process for each of these communities, and kind of streamlining it that way, and so you don't have people who are stepping on people's feet in the community and kind of creating like a bad kind of vibe, I guess, for research. And so kind of having somebody kind of set that up, I think seems like it would be help streamline the process.
Okay, I'll put that on my list. So it's kind of a long list, but Myra? So
That's a great idea. We'll see. Come back in a year, Jacob, and hear back how that's going. So one other thing that what Del was mentioning really resonated with me, because we're working with Intertribal Council right now, actually with Dr. Jamie Ritchie, on is thinking about these data repositories within tribal communities and what's needed. What are the protections that need to be in place? What is the security, and what are the actual logistics of making that happen within a tribal setting? And so we'll be offering actually a webinar. I believe it's in March, and we just talked earlier yesterday afternoon, I guess, about the exact dates, but I can get it to Jacob and the team and make that available to folks if folks are interested in talking about that more. Because sometimes a closed system is really needed, just going old school and not being connected to the cloud, just because of the issues that we heard about earlier this morning on the panel. So if we really want to truly protect the data that's in our repository, we have to make sure that all of those protections are layered on in place. And it may mean being off the internet in order to do that. So anyway, more on that, I think, in a couple of months.
So there are some questions that are coming on our viewers that are joining us virtually. A couple of them are actually directed, I think, specifically to Navajo IRB. So if you can include your email address, we can have Del respond to them. One is regards to what qualifies. I'm having trouble even reading that. What makes the qualified to be part of the IRB? And again, we'll send these to you if you can respond directly. And then you mentioned the 3-year term in terms of the review committee, and some questions about their Navajo IRB specific. The last one is a question about IHS and tribal councils have been mentioned in the process of approvals. And then more specifically about Arizona State is, do we also have an internal IRB approval process? And the answer is yes. Within Knowledge Enterprise, oftentimes they go into the ORSPA, Office of Sponsored Projects and Research Administration. We have something called the ERA, which is a system where if you have grant funding, that's a whole other conversation, but you check a box that this involves tribal communities, and our Office of Research Integrity and Assurances will pull it and then do a review. But also part of my job, as we've talked about, what do I do here? Part of it is also looking at these research projects and really more of a, call it a cultural review, but it's a protocol review because we need to confirm that there is consent Going back to Havasupai, obviously that was without consent. And so are tribal rights protected is really the bottom line. Do you have a resolution from a tribe or from, in the case of Navajo, something that's been approved by their Navajo IRB? Do you have are we talking to the appropriate people? Are you talking to the appropriate people in the community? Before we were seeing them coming from school districts within a tribal community that weren't reviewed by the tribe, but just by the school board or the health board, and we said that's not sufficient. You know, this needs to come from the tribe itself, and so it's more legwork on their part, but really with this idea of ensuring that tribal rights are protected. So that's what we do here. And let me just throw out for a question. If somebody's got a burning question, I'll give you the opportunity. So.
Hi. I was just wondering if you could repeat the name of that grant and like maybe tell us a little bit more about it.
Sure. Yeah. So it's for short, it's called TIRBE, TIRBEE, and it's the Tribal Institutional Review Board Establishment and Enhancement Grant. It's an R24 mechanism available through the National Institutes of Health. And the due date is in January 27th, so it's definitely coming up soon. It'll be offered until January 28th, 2027. So if you can't get an application in this year, this upcoming year, 2025, you have a couple more years to get the application together and partnerships that might need to be in place. And basically, it's an opportunity to either create a tribal IRB or to perhaps layer on additional resources onto an existing tribal IRB. And so there's more information that I can send to folks on the team that organized the conference so that we can blast email probably all the folks who signed up more information about that grant. Oh yeah, that's a great point. So Amanda was just reminding me, it has to come from a tribe. So it can't be random academic research or applying. It has to go through a tribal process.
All right, so Dell, it was Dr. Otakuye Conroy Ben who's with us here on the wastewater epidemiology, so that's a quick handoff for me. You can follow up on the work that we were doing with your Epidemiology Center.
Yeah.
And then also, I want to thank our panelists. Let's give them a round of applause. So, and again, for our online participants, thank you for joining us today. We really appreciate having you. Had a few